We've all been there. You cut yourself and now there is an open wound on your skin, and you're wondering, should you go to a doctor or let it heal on its own? More importantly, what can go wrong? Well, here are 3 things that can go wrong in smaller and larger wounds. So let's learn about these 3 things, and let's learn about dangerous signs that help us identify that one of those things is possibly present. This medical video with illustrations and drawings was created using anatomsky.com. So if you want to make a similar video, you can use that website. But now back to our wound. So here are the 3 things that can go wrong with wounds and cuts: Clostridium Tetani, Staphylococcus aureus, and blood loss that can happen in small wounds as well. All 3 of those complications come with dangerous signs we should recognize. So the spores of Clostridium tetani, that is a gram-positive bacteria, can be found in animal poop and soil. If a wound comes into contact with animal poop, bacteria will find a very nice terrain to grow. A wound contaminated with poop and soil is a perfect breeding ground for Clostridium tetani. But it's not Clostridium tetani directly that causes dangerous signs and symptoms and possibly even death, but instead it's toxin called tetanospasmin. Even in smaller wounds that are infected with Clostridium tetani, tetanospasmin toxin can travel through the peripheral nerves, retrograde, and enter the central nervous system, the spinal cord. When tetanospasmin produced in an infected wound attacks Renshaw cells in the spinal cord, it causes rigid muscles, and it does so by attacking the snare protein. The snare protein helps release the vesicles from the Renshaw cells, and these vesicles contain GABA and glycine, which help prevent spasms and rigidity in the muscles. So a wound infected with Clostridium tetani can cause rigidity and spasms all over your body, most notably around your neck, and it can cause your neck to become hyperextended. Furthermore, it can cause your jaw to be locked like this. Furthermore, it causes rigidity in facial muscles, which can be recognized by raised eyebrows. Even a small wound infected with Clostridium tetani can cause life-threatening breathing problems and spasms so strong that the spine and bones fracture. That's why it's important to recognize dangerous signs of infection, because a vaccine booster shot can be given even after the injury. One more problem with wounds and cuts is if you never do this for this video, or you never share it on your social media, so your family and your friends will never find out about the vaccine. Staphylococcus aureus, gram-positive bacteria usually known for infecting hair follicles, can also infect wounds. This can be recognized by a spreading redness around the wound that is painful. Furthermore, yellow pus could be present, and from there, bacteria can spread across the body and attack different organs in a condition called sepsis. This condition is deadly. There is a common sign for both Clostridium tetani infection and Staphylococcus aureus infection. But first, let us explain dangerous signs that indicate a severe bleeding of the wound. In dangerous, life-threatening wounds, blood might be spurting out of the wound, and this indicates a possible damage of an artery. Furthermore, arterial damage can be recognized by pulsating or thrombing bleeding, and patients might experience lightheadedness and pale skin as well as pale lips. Both Clostridium tetani and Staphylococcus aureus can cause fever and that is a warning sign that the wound is infected and possibly lethal. This sign should never be ignored. Maybe the most important thing about wounds and cuts is to understand that those are just some signs of a deadly, dangerous wound. There are more signs, and to be properly informed, go here, symptomsky.com. But if you're a medical doctor or a student and you want to make a video like this one, then go to anatomsky.com.